Can you guys see my screen?
Yes.
Yes.
Yes, Priya.
All right. So I'm going to just go through a slide two. It's just an introduction, just covering what I'm planning to cover today. It's about the definition, the risk factors, the diagnosis, causes and pathologies, symptoms, treatment, prevention. So among this, I think the most important thing, otherwise it's if it's an exam based, yes, you should know all of these if you have that as a syllabus. But if it's just about what you want to take home with you, it will be more about your diet, your lifestyle for a better bone health, and how you want to implement in you, your family, and your friends. So, when I was little, or when I was an adolescent, or when I was in my 20s, I thought osteoporosis. Even when in physical therapy school, we had to study about osteoporosis, but I thought it's more like a old age issue or 40 plus. That's what my belief was. Even though I learned about it, I didn't practically put it into my world or my life. I didn't put it in. But after moving here, I think I started learning more about it. So I feel like now I wish I knew it more about it when I was more younger. I would have done a better job with my eating and lifestyle. But so for you all, it will be great to take away for you today. Even if you don't know more about the pathophysiology and anything, changes in your lifestyle, your diet, and your activity will help you and your family and your friends to prevent or delay your osteoporotic changes in your body. So I just want to go just mention that first, and I'm going to go talk about a little bit about the definition and everything. So basically, osteoporosis, the mass in the bone gets weaker. So osteoporosis is a disease that thins and weakens the bones. And the thinning and weakening eventually leads into fractures. So until we know the fracture has happened or until there is symptoms, it's a silent disease like heart attack. We never know that it's happening in the bone because we do take x-rays, but it's a regular x-ray. So the regular x-ray never shows osteoporosis unless it's in the late stage. So it's always called as a silent disease and it weakens and thins the bone. And it happens at the cellular level. And so there is bone forming cells and there is bone breakdown cells in our body. So the bone forming cells, if they don't have like a good relation, like a bone forming and a bone breakdown cells, if they don't have that dynamics, then that's when the osteoporosis happens. So the bone breakdown cells act more than the bone formation. So your body is not forming enough bones and the bone breakdown cells overact. So that's when that happens and the changes happens in the cellular levels in the all the bones and the break happens. And so the bone gets fragile and fractures easily. So we as women are more prone to get osteoporosis. But what we see here is men they do have it too, but more steady and slow progression. So with women, women get it in a rapid phase because after 40 and the menopause, the estrogen levels goes down. So as women, we get it more than men, but they are not like accepted from it. They do get it as well, but more delayed and slow onset and not rapidly getting worse like ladies. And the word osteoporosis means porous bones. So the bone has a cortical outside the hard shell, and there is an inner shell called the trabecular bone. So that trabecular bone is the spongy part of the bone, and that get porous because the bone mass is getting extracted for using in the body, and there is no enough bone formation happening. So yeah, so that's the osteoporosis means there is porous bone in your body. And the bones mainly affected by osteoporosis, they are hip, spine, and wrist. I don't see a lot of wrist. I don't know because the occupational therapist deals with them more. I see a lot of spine and hip issues. So most of the time they come with a pain or a fracture or something, the doctor just refers to us and we do a screening to ask about a lot of things, their lifestyle, their lifestyle when they were young, all those questions. And sometimes we refer back to the doctor for X-ray, which is specific to osteoporosis, which I'll be covering later. All right. Then symptoms. So it's like I said, it's a silent disease. You don't know, like I don't know I have osteoporosis unless I take a X-ray, which is specifically for osteoporosis. And sometimes the patients complain with loss of height. Like one morning they wake up, all of a sudden they are losing few inches. And that's the classical sign we see here, because when the fracture, like I said, happens in the spine. So when the fracture happens, they lose their height. The height in each vertebral disc just compensate and they lose their height. As we get older, we lose some height, but that's not the same as losing our height with the like few inches all of a sudden overnight. The other one goes very progressively slow. So don't misunderstand between both. Like as we get older, we might lose few inches, but that's different than all of a sudden getting shot one day or in 2 days and you have pain in the spine, or all of a sudden you're stooping forward like a hunched over posture. That's because the vertebral disc just loses their height because of the porous bone, and you just lose that spinal curvature and height. Shortness of breath happens when your vertebrae all of a sudden collapses because of the porous bone, and your lungs doesn't have enough capacity to inhale and exhale. So a lot of clients complain shortness of breath along with the spinal pain. And there is fractures. Sometimes they tell that, okay, just a little walk, or they just woke up, or they just sneezed, and all of a sudden they heard a crack or a pop, and the fracture just happens. So that's a classical sign or symptoms they say when they come for therapy or evaluation. And pain in the low back. So like I should say 60% of the client we get, they complain pain in the low back. And when the pain cannot be addressed with modalities or therapy, that's when we always screen them, but then we feel like it's more than in our hand, we refer them back to the doctor, and dietary and physical activity, they come back to us for the exercises. So those are the symptoms and pathophysiology. What is happening in the bone? Why is this osteoporosis happening in us? So like we all know, bone is a healthy tissue. So that's the beauty about the bone. We can modify the bone and we can make them healthier. So at any age, your age, my age, or like 60 plus, 70 plus, anybody who comes, who wants to modify their bone because they are healthy living tissue, we can make changes in that. So it's never too late to start your exercises and physical activity and your dietary changes to make the bone healthier. So even if I have changes with osteoporosis today, I can still maintain it or delay the impact by making my lifestyle changes. And so like I said earlier, the bone has an inner spongy area and an outer cortical bone. And the osteoporosis causes the inner bone, which is the trabecular bone, to have porosis, which leads to losing bone mass, and then they get weaker, and eventually the worst case is when they get fractured. And causes of this bone, again, is due to the resorption, like bone breakdown is greater than bone formation. So as we get older, the bone formation will be less and bone resorption will be more. So the breakdown happens at the bone for body to utilize calcium or vitamin, calcium and other minerals in order for the body to function. So we should have enough reserved in our bone to utilize, especially as we get older, because bone formation is not happening at that, or it's not as active as we are younger. So for you all who are the students, this is the time to help with your bone formation and have a healthy bone, get that infrastructure in. So as you get older in your 40s, it's nice to have enough savings there to utilize for your body from the bone, for your calcium and other minerals, or any nutrients from your bone to utilize. There should be enough reserve there. All right. And like you all know, you know more than me about calcium and all the minerals and the sources. So bone stores all of that. And when body needs the calcium, it breaks down the bone, and the process is called bone remodeling and supplies to your body for the need of calcium. And they also helps to keep the body strong by providing and supplying enough amount of calcium. So any calcium needs for your body is coming from your bone. Bone stores it and releases, and the process is called remodeling, and it releases when your body needs it. And the calcium insufficiency leads to osteoporosis and poor bone health. And the other factor, the hormonal thing, is the estrogen. So, like as we get older, especially when we get to menopause, the lack of estrogen receptors impairs the bone formation capability to mechanical stress. So when your body needs the calcium, the bone formation is not enough, or it's not as it was good, or as good as it was when you were younger. All right. And the bone hemostasis, like a healthy bone, always maintain a balance of bone formation to bone resorption. So the breakdown and the formation is always should be balanced to have a healthy bone. But unfortunately, as we get older, men and women, we will lose that hemostasis. And that's quite natural and normal, but we always can delay the process. And the excessive resorption or the breakdown can result in complete loss of trabecular bone structures, eventually leading to fractures and that porous tissue and weak bones. So, what does this mean to all of us? I think the takeaway for your home is they are a living tissue. At each one, what age we are today, you can still keep your bones strong and healthy. And with a balanced diet combined with a regular exercise, you can have a healthy bone at all ages and reduce the risk of osteoporosis. So if you're already diagnosed with it, you can prevent or delay going it to a further level. If you're an adolescent or if you're younger, you can start eating healthy and make your bone much more healthier so that as you get older, you can have enough in your bone bank to utilize when that bone formation get reduced. All right. And this is just like how your bone microstructure is. So again, the whole bone health or the bone strength depends on your bone size, your bone morphology, and properties of bones. A lot of things we can change and make changes, which I'm going to cover later. There are things you can change, there are things you cannot change. Our focus is on what all influencing factors you can change to improve your whole bone health. All right. So, risk factors. Again, like I said earlier, old age is a big factor. As we get older, all of us can go through that osteoporosis, chances of getting osteoporosis. But again, we can delay or prevent it by taking charge of our health for the bone now. Being small or thin, Asians, especially us, we have low, like the bone whole structure is much more thinner and smaller, so we have less bone mass. So that is another risk factor. Genetics. So if you have parents or grandparents who had fractures without warning, we are at risk for getting osteoporosis. Some of the medication like glucocorticoids, those are like, we give it here for the cancer patient, rheumatoid arthritic patients. They don't have a choice. They have to take it. And that affects the bone strength as well. Like when you check your low bone density, like you do a bone density test and you see that it is low, we are at risk. And being Asian, like I said earlier, white, we are at risk as well. Eating habits and lifestyle. That's the major part I like to cover here, because a lot of other things we cannot change, but eating habits and our lifestyle make a big difference in our osteoporosis or the bone health. So that's something we can change. All right. Then what this means to us, again, like I said, if you look at the risk factors, there are things which we cannot change, like our genetics or getting older. Those are the things we cannot change. But our eating habit, our lifestyle, including like tobacco use and alcohol use, Those are the things we can change in order to prevent or delay the process of osteoporosis. And prevention starts when you're younger. So the important takeaway is right now we have healthy bone doesn't mean that after 10 years or 20 years we have healthy bone. We have to earn it. We are putting enough effort to keep that bone stronger with a good lifestyle and a healthy eating and physical activity. I cannot emphasize how much about the physical activity. We get clients, so we most of the time when we get a referral, they get a T-score done. I'll be covering that later. T-score is the value which shows how much do they have osteoporosis or not. That's the scan or the x-ray they do, and the doctor confirms that, okay, this person has osteoporosis. We sometimes get them for a 6-month exercises, and the dietitian helps with the diet changes, and the patients, they take responsibility of changing their lifestyle, including minimizing tobacco or alcohol use if they are already on it. And we see a big change like in their bone health. So after 6 months, they go back to do a scan again. I cannot personally say who commit to this, the change to positive, who's commit to take a change in their osteoporosis and the bone health. We definitely see changes in them, the positive changes we see them, especially the bone score gets better. So I can definitely say that lifestyle along with diet and your exercises make a big difference in your osteoporosis change in your bone health. So even when we have clients with negative 2.5 above is considered as osteoporotic changes with the T-score, we see a decrease up to -2, which is a big significant difference. And I'll be covering that later. I just wanted to mention that so that you can take this home, that any friends or family or for yourself to have a better bone health, start now. Okay, and the prevention starts when you're younger. And let's talk about bone bank saving account. So bone banking is something that what you put in your initial young age, that's what you get as you get older. So your bone will take out from it as you get older because there is no new bone formation like you had when you were younger. So take enough dietary supplements or in good food, which helps with your calcium, minerals, and vitamin Ds, and also a good amount of physical activity now at your younger stage in order to reserve enough in your bone bank to utilize when you are 40 plus. So make sure you have that. So up until about age 30, normally we will have good, we build more than we use. So your bone formation is happening quite rapidly up to until 30. After 35, they break down. So osteoclastic activities happens at that age. And it happens faster than how much you build. So population who has osteoporosis, they lose bone mass at faster rate as well. So after you're 40, the bone formation slows down and bone breakdowns happens more for your body to have calcium and vitamin D into your body. But during younger age, like your age group right now, you can put enough into your bone bank. All right, so this is what I was talking earlier about the diagnosis. So, and why don't we use a regular x-ray? So the regular x-ray does not show if the osteoporotic change is minimal. So if you don't have enough changes happening, the regular x-ray does not show it. So they do this special scanning method, which is called DEXA. It's a dual energy x-ray absorption scan. And then you get a score. That score is called T-score. And anything below -2.5, you're said as you have osteoporosis. Osteopenia is like in between, you are in the path of getting to osteoporotic. And that's between -1 and -2.5. And normal bone, you're considered when it's above -1 bone mass. That's considered as a good bone health. And we normally take here the x-rays of hips and spines, and those are the usually checked ones. And like I said earlier, the normal x-ray does not show that osteoporosis changes unless it's far along where you have to have enough changes to reveal in a regular X-ray. All right, and treatment. So this is one of the biggest part I like to cover, because no matter you use it for your exam or your studies, this is a takeaway for you and practically implement in your lifestyles that helps you to have a better bone health. From 20 years from now, you think back and look back, invest it now. So put enough effort to build a good bone health. Personally, so back in India, like in my 20s, I did exercise, but I was I did diet. Did I diet scientifically or appropriately? I did not. Now I look back, I can't change those, but I do spend like at least 3 to 5 times a week exercising specific for osteoporosis and strength training, because I see a lot of clients with osteoporosis. So, like we say, prevention is better than cure. I don't want that to happen in our body. So I spend enough time on that. I always try to read the label to just keep track what I'm eating. And I have enough supplements. I don't worry about being skinny. I rather be healthy. So that's something I learned over years, that it's okay to be on the heavier side, or it's okay to be not looking like, how you want, but it's all about your health. End of the day, you should be healthier inside and you should have a good bone health, and nothing matters how you look outside. All right. So this is the important part I'm covering, where a treatment, which you can change to prevent osteoporosis. The non-changing factors, don't worry about that, but including exercises, vitamin and mineral supplements, and medication, you should be able to have a client with osteoporosis prevent and delay their progress. So what are the exercises you should be doing? Is walking good? I always get the questions, is walking good? Is water therapy good? What are the exercises that can improve your bone health and your bone mass? I always say any weight-bearing exercises. So you should be putting weight into that joint in order to have a bone formation happening and for a good bone health. And any bone loading exercise. So when you walking is great for your cardio, but if you are doing a little jog, that puts your bone into that pressure or that loading, helping your lower extremity bones, like your femur, your tibia, fibula, ankle, all enough load, and your spine in order to have that good bone formation. So if you walk, you may not get the results. If you're doing a water exercises, it's all unloading activities. So you have to put enough loading into your system, into your spine, or into your bones in order to have that bone strength and more bone mass to build up. And vitamins, calcium, and mineral supplements is recommended and should be recommended by a healthcare provider as needed. And the medications commonly used. So a lot of, like, if the men has testosterone or estrogen, estrogen for women, if there is deficiency, as prescribed by the doctor, we should be taking supplements. And bisphosphonates, these are medications to stop the bone breakdown. So there is no enough bone breakdown excessively happening in the tissue, bone tissue, which helps to prevent the bone mass to lose. And biologics, these are the medication. It's in the form of injection. I had few clients taken that, and the side effects are not known quite yet. I know there are some, but they are not proven or research-wise completely confirmed. So yeah, they're waiting on that. Prevention. So this is for youngsters and also for us, how you can prevent the further progression, or how you can prevent from getting osteoporosis. So this is the most important takeaway for all of us, and taking charge of your bone health. If you have availability to get a bone density test, go ahead and do one. And here we have to get a script from the doctor and everything. So back in India, I'm thinking if you can still get it. And knowing your T-score, if you if you know your T-score now, after 6 months with the lifestyle change and the diet, and along with your exercises, after 6 months, get a scan again. And that will, if that shows an improvement, you are right there helping to keep yourself healthier and with a good bone health. And same with daily calcium from food and supplements. So tell me I'm wrong or not, but I think around 1,000 to 12,000 mg is the daily calcium they are trying to have in your body. And every day try to take calcium rich food. And if you don't take a calcium rich food one day, make sure with the doctor's permission to have some supplements to go in. So daily calcium is very, very important. And same with vitamin D. So vitamin D is needed in your body for the calcium to be absorbed in the bone. So if you have enough vitamin D from sun or supplements or from your food, then you have your calcium easier to absorb into your bones. These are the things we can change. Quit smoking. Smoking definitely increases fracture risk. So try to quit smoking. And alcohol consumption, they say more than 2 drinks affects vitamin D level and nutrition and fall risk. So once a fall happens, the healing in the bone won't be through a good, healthy tissue. So again, the chances of osteoporotic changes will be much more, and the hemodynamics in the bone, that balance will be affected. Again, moderate sugar, salt, and caffeine. Sugar, they say try to limit 25 grams. That's like 6 teaspoons, and salt, 1 teaspoon. And I think I missed, so it's more than 6 cups of caffeine that again causes calcium loss. And again, engage in constant physical activity that will help you to get the bone health better and your T-score up higher. And go for the loading exercises and do the bone like weight bearing exercises or strength training rather than unloading exercises, which helps you to have a better bone health. If you have any questions about exercises, you can email me separately. You can, listeners has my cell number. No, sorry, email. So you can always ask her and send me an email or ask through her. I'm definitely here to answer any questions about osteoporotic exercises. All right. So you can work on great posture. One of the bad exercise is doing sit-ups. So sit-ups produces, like you do crunches, that produces a lot of stress on your spine. So do the reverse way. When you do exercises, make sure you're not crunching your body a lot. That produces a lot of stress on your spine and your vertebrae. So try to prevent that. Work a lot on your balance and proper body mechanics that prevent stress on your joints and your bones. Prevent falls. Like I said earlier, falls can cause, the bone will then heal with different tissues, and that can eventually lead to osteoporosis as well. So risk factors, again, takeaway for your home is you can change things, including your physical activity level, diet, include more calcium and vitamin, quit smoking and drinking. Make sure you're drinking not more than 2 cups or 2 glasses, and a balanced diet. So the risk factors which we cannot be changed, it's being a female, postmenopause, body weight. So if you have a small bone, the bone mass is very, very less compared to a regular bone. And the genetics and certain drugs and steroids, which you cannot avoid because of your health issues, thyroid medication, and unexpected bed rest, which you cannot, control all those things. So in our therapy here, we do some primary, secondary, and tertiary prevention. So primary is like a healthy individual coming, they wanted to delay their onset. So we go through diet, we go through exercises and lifestyle changes. Secondary is when there is something going on, like you have diabetes and you are more prone to have osteoporosis. So we again train them with specific regimen using diet, exercise, and lifestyle. The tertiary is where already the fracture happened or already there is an osteoporosis established. How you can minimize and delay going it further, and how you can give them an optimal function in order to have a good life. So those are the three things we do in our settings here. All right. So bone health diet. I know you guys are the masters in this, but I'm just kind of covering a little bit. A balanced diet combined with regular exercise will help to optimize your bone health at all ages. I have to emphasize that it's all ages because that will reduce the risk for osteoporosis. So there is no age limit. We can try it from today for all of us. So goal of the bone health diet is, so if you're a kid or in your adolescent, is to build maximum peak bone mass, which you want it in your bone bank in order to utilize as you get older. And for your adult, it's to maintain bone and avoid premature bone loss. So we should be still having a good diet. Seniors to sustain mobility and independence. So for them to have a good independent and mobility, even though they have enough breakdown happening, they still can be kept with a good maintenance osteoporotic bone if you are in all of those regular exercise, diet, and lifestyle changes. All right, so let's talk about calcium and vitamin D. So calcium is the mineral that helps build and maintain strong bones and teeth, like you all know. And 99% they are stored in the bones and the teeth. And 1% circulates in blood and soft tissue. And we need calcium throughout the life. And they say, I have some how much you need, like the recommended allowance, like 19 to 50 years, you should have 1,000 milligram per day. 51 to 70, they say 1,000. Women 51 to 70 years, they say 1,200. 71 plus 1,200. So you can see as you get older, we need more calcium in the body because the absorption or the absorption rate goes down. So we have to have enough. And how do you get it absorbed? Regular exercises and that metabolic activity in the body helps to absorb it too. If you don't consume enough calcium through diet or supplement, our body will take calcium from bones. And over time, if it continues, bone gets fragile and more likely to break, leading to osteoporosis. So what should we do? Best way is enough calcium, eat enough calcium-rich food every day. So talking about vitamin D, so that is, if you take enough vitamin D, that is important for calcium to be absorbed by the intestine. So it kind of works as to build calcium in your body and maintain bone health. So vitamin D is considered as the key, which unlocks the full value of calcium. So if you don't have enough vitamin D in your body, the calcium absorption rate will be lesser. So you should have enough vitamin D in your body. And I do have a little, like they say 19 to 50 years, you should have at least 600 international unit per day. Men over 51 to 70, 600, 71 plus years, 800. So again, here also, when you're 71 and older, you need a little bit more than regular. And like the dietary sources, you can have fish, dairy, like salmon, sardines, any canned fish with enough small bones, dairy like milk and vitamin D milks, and some of the cereals and juices has it too. I went with what we have it available here. I'm sure there is a lot of options back in India we can find out too. So yeah, fish is a great source here. We get mostly frozen fish, especially Indian fish. So you guys get fresh fish there. So eat that and get your vitamin D stronger. Okay, that's what I just covered. And just see whether, talk to your doctor about appropriate, if you need a supplement, make sure you're talking to your doctor. Either it's calcium or vitamin, because there is a stop where you shouldn't exceed so much a day. So if you have enough from your food, you shouldn't be taking supplements. So talk to your doctor about how much you should be taking as a supplement. Okay, and sun exposure. So there is a conflicting theories about sun exposure, because if your skin is pigmented, if the sun is not good enough or strong enough, or the rays are not strong enough, that UVB rays are not good enough, sometimes that exposure doesn't mean anything. But 10 to 20 minutes of sun exposure to your bare skin with no sunscreen is also a good source to get vitamin D into your body. But I would rather go with the food option, if given a choice. And before 10 a.m. and after 2 p.m. daily is what they recommend. Okay, and so protein should be there to prevent the osteoporosis. So protein provides the body with a source of essential amino acid, again, which is necessary for your bone health. Low protein intake is detrimental both for your building of peak bone mass. So if the bone mass is sorry, my dog is just looking. I'm sorry. Um, okay, so if your low protein intake, they determine both for your building of your peak bone mass during childhood and adolescence. So make sure you're taking enough protein in your body. Okay, and that helps to prevent osteoporosis as well. And micronutrients, what are the micronutrients? I know you guys are masters in it. I'm just kind of vaguely covering it. So they are only required in trace amount, but it helps with your normal bone growth and development. So they are including vitamin K. So any leafy green vegetables, spinach, cabbage, kale, liver, dried fruit, they all provide vitamin K. Try those. Those trace amount will help your normal bone growth. Magnesium, almonds are great sources. Green vegetables, nuts, seeds, fish, and dried fruit are as well. The other micronutrient is zinc. You can get it from beans or chickpeas. They are also found in red meat, lean red meat, and poultry, whole grain cereals as well. And carotenoids, you can get it from carrots or any vegetables, including green leafy vegetables. So key is building bone, a good bone or healthy bone in your early life. And it starts in life when you're young. And so you're at your younger age, try to put enough good nutrients into your bone and get the bone bank reserved for you to use in later in your life. So like from the fetal stage, we start with the maternal nutrients that helps to develop your skeleton. In childhood and adolescence, it's a critical stage for bone building with size and strength of bone, because they increase significantly, and you are getting it through physical activity, diet, and lifestyle. And so nutrition intake and a combination of physical activity aids in achieving optimal bone strength and reduces chance of osteoporosis and delays onset. So the key is all of us, no matter what age we are at risk for osteoporosis. So if you can get your lifestyle, your diet, and your exercises into a good, better, systematic way, you can have a better bone health and delay the osteoporosis changes or even prevent it. All right. This storage of bone mass can be utilized in late adult. Like I said, anything you store, it will be utilized later because bone formation is not happening, and there is more bone in reserve from your younger age, and you can withdraw more. Unlike in their younger years, adults cannot replace bone tissue as quickly as they lose it. Peak age of bone building is said to be 14 years in boys and 12.5 years in girls. So exercise and lifestyle matters no matter what age you are. So for adults who already have osteoporosis, or chances are more, at this stage, ensure your healthy nutrition with sufficient calcium, protein, vitamin D, and important micronutrients, and make sure you're doing loading exercises, including strength training and weight training. So we design very specifically the exercises to delay, maintain osteoporotic changes, which plays a crucial role for you to prevent fracture and further health issues. Anything about calcium supplements, talk to your doctor. Hormonal therapy, talk to your doctor. So, conclusion is osteoporosis is often considered as a pediatric disease, but again, it's a silent disease. We don't know until we get to that age where symptoms are seen, which is our mostly we see in older adult age. It is a silent disease. 75% of the bone profile is genetic, but things we can change is you can prevent the progress or prevent the um, negative impacts by changing the lifestyle, nutrition, and specific exercises. So create a good saving bank. And if we don't, then we have less to use from our bone bank for our entire lifespan. And certainly we lose bone, leading to osteoporosis. We all will lose bone mass as we age, rapid in women than men due to menopause and lack of estrogen. Men, they are not, they still get it, but they catch up as well too, but more slow and steady changes. So, key to bone health and delaying osteoporotic changes is how much healthy bone we grow and what was the quality of that bone we initially established during our adolescence. So, the takeaway for you today as youngsters is make sure you start reserving enough into your bone account. All right, I'm going to go with questions and comments and see what you guys have questions for, or any feedback or any comments, anything you have to ask me.
Participants, those who have doubts can directly come up with the questions. Priya, your class was so excellent. So I just have a doubt regarding this bone degeneration.
Mhm.
To what extent there is a risk for those who have a bone degeneration to have osteoporosis?
They are definitely more prone. So arthritis and osteoarthritis and osteoporosis is little different, but chances for them with degenerative changes, I'm thinking part of it is like lack of exercises and the arthritic changes. They have some degeneration happening in specific bones, especially the weight bearing bones. Yes, so for them already the bone health is not the great, right? So yeah, so for them to for the chances to get osteoporotic changes, I consider more. A lot of times I get clients with osteoporosis and arthritic changes and degenerative changes combined in the x-rays. Like if you look at their x-rays, you see the advanced osteoporotic changes. So and already there is changes happening initially, but then it shows in the x-rays because they are advanced. So I see a lot of combination of degenerative changes and osteoporotic changes together.
So if there is a severe lumbar degeneration, what can be done?
So for you do specific exercises for your lumbar. So degeneration or arthritis, we cannot reverse it. But if we treat the symptoms, so what are your symptoms? Like if you have pain, or is it you feel like your core is not, or your back muscles are not strong enough? So we go with core exercise, stability exercises to get your muscle surrounding stronger. And like I said, bone is a living tissue. So those loading exercises helps your bone to make enough changes to get stronger or maintain before going into further degeneration or arthritic changes. So there are exercises like, I don't know what is the specific should I say, symptoms you have or anybody has. But if a person or a family member or anybody in this group have any issues specific, we always can talk about it because we need to know the symptoms. If so, I'm assuming you're not looking just to get that degeneration better. You wanted to know what helps to get the pain or the instability or something else better. Am I
Yes.
right?
Yes, yes, exactly.
Yeah. So yeah, we always treat the symptoms because eventually after 6 months you can take an X-ray and look whether there is any change osteoporotic. Like how do you know that the T score has gotten better? But if you're looking at the symptoms, we offer so because a patient coming with a degenerative change in the low back and another patient, their symptoms could be completely different. and we treat the symptoms. So we need to know what are the symptoms they have. Is it the pain in the back, or is it pain down to the leg, or is it the weakness in the hip muscle, or your SI joint is out of place? So those are the things we check in order to specify certain exercises. But exercises definitely make a difference in that symptoms. Yeah, if it's like to a level where nerves are involved extremely and they are losing strength to the legs, that's when we refer them back to the ortho. But you can always email me and ask, or just send a WhatsApp asking, like, okay, these are the things, what should I do? I can always give a call for that specific
Okay.
symptoms, what you can do to get it better. Hope that makes sense.
Okay.
And
Okay.
I didn't want
Thank you,
to,
Priya.
yeah, I didn't want to ask in the group what are the symptoms, but if you want to say, I can just, look into it. But if it's a specific condition, it's always nice to talk privately about, whether we can help with it or not.
Okay, Priya.
Mhm.
A small announcement to the participants. A feedback form is put in the chat box. Those who need the certificates, as well as we need to know your feedback also. Kindly fill it up. The feedback form is in the chat box. Kindly fill it up. Is there any other doubts? Anyway, Priya, that the session was really excellent. It's really informative also. In case we have any doubts, we will contact you through the mail.
Sure, Miss.
Sure.
So
Okay, thank
yeah, so this was great. Thank you so much. Hope you guys had got some information which I shared that makes sense, and you can take it home with you and practically utilize. So you guys have a great evening. Remember to eat a well-balanced snack and dinner tonight, and same some physical activity. Okay, make it a habit. I did that too. I didn't want to start, but I started that. Will I get changes? I'm sure, but it always helps to have a healthy bone in the future. As we get older and older, you'll be thankful to put enough reserves in your bone bank. So do that. Okay.
you. Okay, that's a nice concept of having bone bank. Let me now invite Ms. Sharon Abraham, Assistant Professor, Department of Home Science, to propose the vote of thanks. It's over to you, Sharon.
Thank you, ma'am. Good evening to one and all. The best and beautiful thing that cannot be seen or even touched. It must be felt by heart. Thank you is one such prayer among them. I deem it a great honor to propose the vote of thanks to all the dignitaries and all the beloved present here. First of all, I extend my gratitude to our dear resource person, Dr. Priya Arunmon, to take out time from her busy schedule to grace the event and enlightening us with her knowledge. We all agreeing that the session was full of knowledge and interesting things. It gave deep insight into the topic and also revealed some facts also. The point ma'am discussed about the diet and the lifestyle for a better bone health. It was really interesting and very informative. I'm pretty sure the precious knowledge shared with us will definitely help us in our life at present and in future. Thank you, ma'am. Thanks a lot.
Thank you. Thank you for having me.
I would like to express my profound gratitude to our respected principal, Dr. Sister Losley A.V., and our beloved HOD, Dr. Lismita Godwin, for providing immense support to make the webinar successful even amidst the pandemic. Along with, I must thank all organizing team and all my dear colleagues and all the participants make the webinar a great event. On behalf of Morningstar family, once again I thank all for your cordial cooperation. Thank you, ma'am. Thanks a lot to you. Thank
Thank
you.
you. Thank you for having me. Have a great evening.